I'm Bulabinaka. My name is Dr. Krishan Prasad. I'm acting as my position over here is acting SMO, Senior Medical Officer. And I've been here for past 3 years, going into the 4th year. We have obviously noticed a lot of development going on. We had a change of the floors of our health center. The floors were rotten, and then it was changed. The whole floor of the health center was changed by the health team. We also had for our medical area, the Kadavu medical area, where the Vingele Health Center was upgraded. The renovation was done at the Vingele Health Center and the doctor's quarters, which is complete now. And there's installation of new tank at the Vingele Health Center with a new standpipe. With the mortuary, as we know that our mortuary has not been working for almost 4 years now. Now it's been multiple scopes have been done and works have been going on. So it is the upgrade of electrical has been completed. Just recently, almost 2 weeks ago, we had an installation of two 10,000 liter tanks for the backup of our hospital in Funisia. We are planning to make social nursing station to develop into a health center, and the materials for social nursing station is already in Funisia, just awaiting carpenters to come and repair. There has been for Nalotu, there has been a repair of the nursing quarters ongoing now with the installation of the tanks. So there is Nalotu nursing station is currently closed because of the water issues at the nursing station, but the team is there to fix the problem. So, and the Talolia water tank is currently in progress with Kavala and Nangara. It is completed. We have good feedbacks from the patients, and also with this development we have noticed that patients are coming to the hospital and getting treated here, so they are not going to Suva for the treatments. They're not traveling across for treatments, which save money for them, and the services are being provided. So all this development brings it with staffs as well. So the services being provided which reduce their traveling to Suva for just medical reasons. Due to this the geographical location of Kadavu, teleconference is a very essential tool for us. We have been in teleconference with internal medicine in Suva with our counterparts, and also with Tumi Hospital. Other teleconference we are would like to initiate is with the Children's Department. Children's Department regular teleconferencing with them and other units as well, so that all those cases are just discussed here, and then we can manage them at this level, or if need be, then they travel across. A patient traveling from Kadavu to Suva, it's costly for them. So teleconference has reduced a lot of burden for this. Just to go and seek specialist care on Suva, where the specialist on the other side can advise the local GPs on the continuation of the care of the patient. Other achievement we have achieved this year is that we had a surgical tour. So a surgical tour team of surgeons with the Children's Department also came to the subdivision, where they did 76 operations in 5 days. These 76 operations, there were few major operations which was done and few minor operations. Of these, the patients were brought in from the village to the hospital, and to the hospital to the village on free of charge. Transports were provided to and fro to take these patients. There was nil complications, and the surgical tour went well. Lastly, with the quarters, as we mentioned, that it is a challenge, but we are fortunate that the MOIT came to scope our quarters for the renovation. So they've scoped the quarters, what renovations need to be done.